Good afternoon, this is Josiah, your news anchor for today's APP6 Channel 6 news forecast. We will be discussing the trending new topic of the endocrine system. First off, the system includes major organs such as the pituitary, pineal, adrenal, and thyroid glands, thymus, and reproductive glands. Hormones associated with the system are secreted via ducts into the blood to affect organs or tissue. Some hormones include ADH, oxytocin, calcitonin, and a growth hormone. These hormones can be divided into three main types: amines, proteins and peptides, and steroids. It is important that the system works since endocrine glands are associated with the neural control centers by homeostatic feedback mechanisms. Most endocrine glands are negative feedback loops where decrease in function is triggered as a response to a stimulus such as the regulation of blood calcium levels to maintain homeostasis. In positive feedback loop, the endocrine system allows for the original stimulus to be increased instead of negated, seen for instance in childbirth. The hormone oxytocin stimulates and enhances labor contractions. The nervous and endocrine system act as communication tools for the body to maintain homeostasis. The endocrine system consists of ductless glands and act as communication tool alongside the nervous system to send out messages inside the body. After the short break, we will be discussing next with Amy Shum, one of the endocrine system's most grave disorders, hyperthyroidism, or better known as Graves' disease.
Do you feel like sadness from inside out? Do you wish to be more like joy? Do you constantly suffer from a constant sense of hopelessness, anxiousness, and despair? If you are like me, day-to-day activities continue to get harder and harder. I have difficulties in working, sleeping, eating, and even enjoying activities with my friends and family. Things just don't seem like they used to be anymore. These are some symptoms of major depressive disorder, a serious medical condition that affects over 40 million Americans. Though main causes are uncertain, depression can be related to imbalance of chemicals and neurotransmitters in the brain. That's why prescription Zoloft attempts to correct this imbalance. Zoloft, however, is not for everyone. Zoloft should not be taken with MAOIs and other antidepressant drugs. Side effects include dry mouth, insomnia, nausea, dizziness, upset stomach, changes in appetite and weight. Call or contact your doctor if your side effects worsen to vomiting, hallucinations, weakness, memory problems, stiff muscles, or even uneven breathing. Signs of an allergic reaction include difficulty in breathing, swelling of the face, lips, tongue, and throat. Meet with your doctor today and ask about Zoloft, the #1 prescription for major depressive disorder. Get your regular life back.
Welcome back, viewers, to APP6 Channel 6 News. Like we were examining before, one of the major endocrine system disorders is hyperthyroidism, or Graves' disease. Let's go to Amy Shum, our field reporter, for more information on this case.
Hello, Josiah. I'm reporting live on Saxon Hall Lane. More on the topic of Graves' disease. An estimated 20 million Americans suffer from some type of thyroid disease. Graves' disease is a type of hyperthyroidism, an autoimmune disorder triggered by both genetic and environmental factors, affecting approximately 2 to 3% of the U.S. population. Let's go to the streets and see what others know and what other locals know about Graves' disease. What do you know about Graves' disease? Have you ever heard of it before?
I've never heard of Graves' disease. Where does it affect the body? Can I get it?
Actually, it affects the thyroid because it produces excessive thyroid hormones. And you can't really get it, but it's mostly due to environmental and genetic factors.
Okay.
Hi, may we have your name?
Brent Norwood.
So do you mind telling us what you know about Graves' disease?
I believe it is a disease that involves an hypersensitive thyroid overproduction.
What else do you know? Do you know anything else?
That it's just caused hyperthyroidism, which leads to massive weight loss, anxiety, irritability. It just throws your whole hormones off.
Alright, thank you. Hello.
Hi.
Do you know anything about Graves' disease, or have you ever heard about it before?
I think my cousin has it actually. Isn't that when your endocrine system makes too much hormones in your thyroid?
Right.
Yeah, and it's like, I think it's more like prevalent in younger women, right?
Before the age of 40?
Yeah, I think so.
Alright. This is Amy Shaw reporting live on Saxon Hall Lane. Back to you, Josiah.
Thank you, Amy, for the interviews. I actually had an interview earlier this day with a special guest on APP6 News. Hi, on today's show, we'll be interviewing David, who's been diagnosed with Graves' disease for the past 2 years. Thank you, David, for being on today's show.
It's my pleasure.
Do you mind if we ask you some questions about your disease?
Yes, I want to bring awareness to my condition.
Do you mind actually just telling us what is Graves' disease?
Of course, Graves' disease is a swelling of the neck and protrusion of the eyes, resulting from an overreactive thyroid that produces excessive hormones. It is associated with thyroxine and triiodothyronine, which controls the body's metabolism. This is a hypersecretion because it makes too much thyroid hormones.
So what are your symptoms and how do they affect your everyday life?
Some symptoms include crankiness, sweaty, tiredness, anxiety, enlargement of the thyroid.
Oh wow, that sounds serious. Are there any treatments?
Oh yes, there are some treatments including radioactive iodine, which destroys thyroid tissue cells, reducing thyroid hormones levels. This costs $250 to $400. Make sure you get the right nutrition and exercise after proceeding with the treatments.
What about medications? And if so, how much do they cost?
Most medications are affordable, such as methimazole, $7 to $15 for 30 tablets, and propylthoracil, $63 for 180 tablets. That interferes with the thyroid gland's ability to produce hormones.
Thank you for joining us on today's show. We really appreciate it.
Thank you. It was a pleasure being here.
Unfortunately, David later went into the hospital. But anyways, thank you for tuning in on Channel 6 APP6 News. Good night. We're anatomists. We know your body better than you do.
Life brings on many challenges each day, but my anxiety and irritability, increase in heart and metabolic rate, sweating, heat sensitivity, bulging of the eyes, and swelling of the thyroid, and weight loss seems to weigh me down even more every single day. I have tried various medications, including therapy, levothyroxine, and even aspirin, but nothing seems to alleviate my condition. It's getting much more difficult to perform simple daily activities. That's why I went to my doctor, who told me that I was diagnosed with Graves' disease. As grave as that sounds, he introduced me to the treatment of radioactive iodine therapy taken by mouth. Some people had symptom improvements as early as several weeks. Radioactive iodine is not for everyone. Symptom improvement can show as early as several weeks to several months, depending on the severity of your condition. Call your doctor if you experience an increase in new or worsened symptoms of Graves' disease. Side effects include tenderness in the neck, metallic taste in the mouth, nausea, swollen salivary glands, fatigue, or dry mouth. Radioactive iodine therapy is not recommended for those with moderate to severe eye problems or to treat pregnant or nursing women. Radioactive iodine really changed my life and eased many of my symptoms of Graves' disease. Ask your doctor today if radioactive iodine is the right choice for you.